Is this position good?
Thank you.
My name's Carla Labella.
I'm Marisa Mariella.
Hi, well, I'm Tracy Stacy. I know it's a mouthful, rhyming.
My name is Sid Stacy.
My name is Kevin DeCock.
So the Suicide Prevention Community Council of Hamilton has been serving the city for the past 45 years. And our work is focused on hope, help, and healing.
Hope is such an important word, and for me it goes hand in hand with healing and helping.
Healing is all part of the support that we provide in terms of helping individuals who've experienced loss by suicide.
What I see around me now is kind of a growing loneliness epidemic. So imagine feeling this kind of pain and feeling that you're alone and you don't have that support around you.
There are so many people who at various times in their lives may cross paths with somebody who's contemplated suicide, and if somebody understands what the triggers are and knows what to look for, I think everybody at any time could have an impact.
Suicide's preventable. I think a lot of people believe the lie that it's hopeless, but I think there's always hope. So our work is really focused on hope, help, and healing.
A lot of people want to help, but sometimes they don't know how. And I think our organization comes in to give people the knowledge, the attitude, and help them find the skills so that they can help.
We train thousands of individuals on being able to recognize the signs. We do education and awareness.
We're willing to have those conversations. I think there's still stigma when it comes to mental health, to addictions, to suicide, but by being willing to ask the questions, to listen, and to connect individuals with resources, I think we are giving hope.
And I think one of the things that could really help our communities, help our family, help our friends, help each other, is to not only focus on the victims, but to focus on the support system as well.
Intervention, prevention, and postvention. And I think those are the main pillars that we focus on, and it really makes a difference to people in our community.
It's only when we can talk about suicide that we can make the difference.
We each have a role to play as family members, friends, colleagues.
We have, the Be Safe app for Hamilton, and 988 is Canada's suicide prevention hotline. And it's really communicating crisis and mental health supports in our communities so people know where to reach out to.
I think it's really important to understand that whoever's watching this, chances are they know someone who's died by suicide, either personally or indirectly.
My daughter Rachel died 18 years ago from depression and suicide at the age of 18.
And I've also lost 2 cousins to suicide because they believed the lie of hopelessness. And I think it's so important that our work interrupts that lie.
That's what makes me feel so passionate about this organization and what we're trying to do, because we're trying to help people understand more so that we can do more.
We can make a difference, and it's a rewarding work and it's important work.
We need to equip people to interrupt the lie of hopelessness, because there is always hope.
Why make this video?
I had a friend of mine came up to me and said, tell me about your work, I don't really understand it. And I thought, we need a video.